This sign warns that a stroke, also known as a cerebrovascular accident, is on its way. It's very important for you to know all the warning signs and symptoms because many times you can actually prevent it. Many of them show up days before, even 7 days in advance, so you can take action to prevent it, to keep the worst from happening, to really prevent a stroke from occurring. That's what this video is going to be about. After I tell you about the signs that come before a stroke, I'm also going to give you 7 tips to prevent it. There's even one tip that can reduce your risk of having a stroke by 40%. Just look at how important today's video topic is. Alright, let's start with the signs that appear before a stroke happens. There are 9 of them. And the first sign that a stroke is on its way is increased blood pressure. When we talk about high blood pressure, it's important for you to know that strokes can be divided into 2 main groups, and high blood pressure increases the risk for both groups. Scientific studies have shown that in the days leading up to it, this increase can be even more pronounced, especially at the moment of the stroke. So it can be a warning that something is wrong and you need to take action. And what are these groups and why does this happen? When we talk about strokes, it's important to separate them into ischemic strokes, which are caused by a blockage, whether by a buildup of fat that prevents blood from reaching a certain part of the brain, or by a clot that travels and gets stuck there, causing ischemia. The blood can't reach that area to nourish it. This type of ischemic stroke, caused by an interruption of blood flow, makes up the majority of cases, between 80% and 85%. There's another major group, also very significant, which is hemorrhagic stroke. A stroke caused by bleeding. That's when a blood vessel bursts and you lose nourishment and blood supply to that part of the brain. And high blood pressure greatly increases the risk for both types, both groups. So it's really important to keep an eye on your blood pressure readings. I'll talk about the numbers in a bit, but a good number to aim for is the well-known 120/80, so it doesn't go up. That way, you lower your chances of having a stroke, also known as a cerebral hemorrhage. So when your blood pressure is going up and you don't know why, if your pressure has been higher than usual in recent days, that's a big warning sign. Something could be wrong, and often it's a trigger for a stroke to happen. Or it could be a blockage in blood flow, because high blood pressure can damage blood vessels and make it easier for cholesterol and fat to build up. And also, if you already have some kind of malformation, or if any blood vessel is weaker than normal, the increase in blood pressure can be a trigger for this to happen. So it's really important that you know about this warning sign. The second sign that can come before a stroke, and this is a major warning sign, is a decrease in strength on one side of the body or in a limb, either the arm or the leg, or even in both. This reduction in strength can be temporary, which we call a mini stroke. In other words, I'll talk about that. This term isn't exactly correct, but it's the most common one, which is why I'm using it here. The so-called mini stroke, or the correct term, which is transient ischemic attack, is when there's an interruption of blood flow and your body is able to reverse it on its own. And it doesn't leave any kind of after effects. So sometimes you experience this for just a few hours. And why did I use that title for the video? There, 7 days before. Because this type here, the transient attack or mini stroke, is a major warning sign. 20% of people who have this type, which doesn't leave any after effects, will go on to have a bigger stroke right after, or 7 days, sometimes 2 weeks later, you know? So beforehand, it's really important for you to stay alert. Even if you've gotten better, you need to get this checked out urgently to see what's going on. Why did this loss of strength happen? Okay? So that loss of strength that gets better right after, in just a few hours, sometimes a day, with a full recovery, is a warning sign, because you might be having a mini stroke, which often comes before a full-blown stroke. That one, yes, can leave you with a lot of after effects and be very serious. The third warning sign that a stroke might be coming is decreased sensation, or tingling, or numbness on one side or in one limb of the body. Just like I mentioned with the loss of strength, here, numbness or changes in sensation count too. And why is that? And you see, I keep mentioning one side of the body. That's one of the hallmarks of a stroke. Depending on the area it ends up affecting, you'll notice symptoms or signs in a specific part of the body. Usually it's the opposite side. If you have a stroke on the left side, it's the right side that will show these signs. So, changes in sensation. Sometimes it might just be in the leg or just in the arm or in both. But any change in sensation, numbness, these are things you need to pay attention to because you could be having a mini stroke. And the fourth sign, which is also a major warning sign, is a change in speech. Sometimes the speech becomes slurred. When I used to work in the emergency room, I remember that many patients who were having a stroke or a mini stroke or a TIA, a transient ischemic attack, their family members would come in saying, "Look, it seems like he's drunk. He's talking the same way." Like a drunk person, his speech is slurred. But what he was actually having was a stroke. So, changes in speech. Remember that. It seems like the person hasn't had any alcohol at all. But the way they're talking, it seems like they have, like they're drunk. So that's a major warning sign. In other cases, it can also affect REM. Then the person can't speak at all, which we call aphasia. That's also another kind of change that can come before a stroke. And depending on the area that's affected, since I'm talking about language changes, there can also be a change in comprehension. The person might still be able to speak, but they can't understand what's being said. That's another subtle sign, and often it's not that obvious. So we can have a change in comprehension or in speech. This can come before a stroke. Sign number 5, and this one too. In scientific studies, we've seen that it often comes before a stroke, and that's a headache. And this headache usually has a certain characteristic. Sometimes it's more intense than usual, or it's a headache that's progressive, different from the ones you usually get. So that's something you need to take into account as well. Since headaches are such a common symptom, I want to draw your attention to those that are unusual or extremely severe. If you have a really severe headache, it's worth going to the emergency room because it could be a sign of bleeding there. For example, the longer you wait, the higher the chance you'll have lasting effects or a more serious complication. That's why this video is so important. Besides teaching you tips to prevent it, it's also important to recognize the signs after it has happened, or even before it happens. You see, this can actually happen days before you have a stroke. And a sign? Number 6, fatigue, feeling tired. This one is more non-specific, so I won't dwell on it too much. There are several conditions that can cause this symptom, but in reports from patients who had a stroke, many said they felt more tired in the days leading up to the event. So that's another sign to pay attention to. Number 7 is a change in vision. This change also tends to come on suddenly. It's not the kind of change where you just can't read. Sometimes you have to stretch your arms out to read. That's a change you've always had. But this is a change that comes on all of a sudden. Sometimes it's blurred vision or a very sharp decrease in your visual acuity, your eyesight, happening very quickly. That can also be a sign that something is wrong, and it could lead to a stroke. Next up. And sign number 8, another warning sign that a stroke might be coming, is a change in motor coordination. Like when you're driving, for example, or even when you're washing dishes, sewing, or using your cell phone or computer, for instance. You're having trouble that you didn't have before. Why is that? Depending on the area that's being affected, this can also happen. Just like sign number 9, which is a change in balance. A change when you're walking, a change in your gait, for example. It's harder to walk now, or to go upstairs. You feel like you're off balance. This can also be a sign that something's wrong, and that a stroke might be coming. Or you could be having that mini stroke I mentioned, which can come before it. Or it could already be a stroke. This is really important. Why? Because a lot of people only know about those signs I mentioned, changes in sensation, changes in strength. These other ones get forgotten, so it's important for you to pay attention. So, your balance. And many times, there are some strokes that will only show this sign. Did you know that? Just a change in balance. And now, what are the 7 things you can do to help reduce the risk? By a lot? You saw that there's one that can reduce it by 40%. So stick around until the end to find out which one it is. Well, there are 7. What are these 7? The first one, to lower your risk of stroke, you need to manage your blood pressure levels. You probably knew this one since I mentioned it in the video. This is also the most talked about. You have to keep an eye on your blood pressure. I've already explained the reasons, so I won't dwell on this too much here. But numbers like 140 over 90, for example, already increase your risk of having a stroke. And you don't need both numbers to be high. Even just 140 is enough to raise the risk. It could even be 140 over 70, for example. Or the second number, which is called diastolic hypertension. If someone has 120 over 90, for example, oh, but 120 is a good number. Or 120. But 90 is already considered high blood pressure. So you have to look at both numbers and keep your blood pressure in check. The second way to prevent it, and a very important one, to prevent a stroke is by keeping your blood sugar levels under control. Did you know that even slightly elevated levels can already have consequences and increase the risk of cardiovascular diseases like stroke? So keep your blood sugar levels under control. Why is that? When blood sugar goes up, the excess glucose molecules can harm your blood vessels. They can damage your blood vessels. Just like I mentioned with high blood pressure, when blood sugar increases, the same thing can happen. A lot of people ask, why does high blood sugar cause a heart attack? Actually, stroke and heart attack too, but the topic of this video is stroke. It's because high blood sugar can damage the inside of your blood vessels, making it easier for cholesterol to build up, for example, and weakening the blood vessels by damaging them. So it's important to take care of your blood sugar as well. Number 3. And another way to prevent a stroke, which you probably already know, so I won't go on too long about it, is not smoking. Smoking can also damage your blood vessels. And here I'm talking about cigarettes, hand-rolled cigarettes, e-cigarettes, regular cigarettes, and cigars too. So don't smoke, avoid tobacco use in general. And number 4 is exercising regularly. It can be any physical activity you have access to or that you enjoy. I just want to highlight one number here, 150 minutes per week, split into 3 or more sessions. So 50 minutes 3 times a week, or 30 minutes 5 times a week. That works too. It's a great way to take care of your heart and your brain, helping to prevent strokes. The 5th way is by managing diseases that greatly increase your risk. Did you know there's a condition, Grandpa? I want to highlight 3 diseases here. 3 conditions that can really increase your risk but can be managed. The first is obstructive sleep apnea. Sometimes when you're sleeping, you snore a lot. Maybe someone has told you this, or you wake up feeling really tired, or you wake up during the night feeling like you're suffocating. Actually, it's not just a feeling. What happens is that the flow of oxygen gets interrupted, and the level of oxygen in your tissues drops. This has really bad metabolic consequences, raising your blood pressure. It can even cause high blood pressure, increase your blood sugar levels, and greatly raise your risk of having a stroke. So you really need to pay attention to this aspect of your sleep. If you keep waking up a lot, feel like you're suffocating, or someone tells you that you snore a lot, that's a major warning sign. And there are ways to diagnose and fix this. There is treatment available. The second condition, these are thyroid disorders, which can cause high blood pressure, both in hypothyroidism and hyperthyroidism. It's very common to see patients whose hormones are out of balance and who have serious blood pressure issues, which can greatly increase the risk of having a stroke. And the third condition I want to highlight here, and this is also a major cause of stroke, is atrial fibrillation, a very common arrhythmia. But what's the problem with this arrhythmia, with atrial fibrillation? Because it can send clots or thrombi to your brain, causing an interruption in blood flow. So proper treatment is needed, often blood thinners, to prevent this. Okay? Regarding the second disease I mentioned, thyroid disease, it's important to point out that it's the disease before diagnosis, or when you know you have it, but the treatment isn't working or is inadequate. If you have a thyroid condition, but your treatment is going well, everything's fine, and you don't have an increased risk. Okay? There's no need to worry. And number 6, another one I want to highlight here is cholesterol. Did you know that proven high cholesterol levels increase your risk of stroke? And I want to specifically point out bad cholesterol, LDL cholesterol. When it's elevated, yes, you do have a higher chance. It's important to point out that there isn't a fixed value for LDL cholesterol. It depends on each person's risk. Your doctor can calculate this and determine what your therapeutic goal should be. That's why I'm not going to mention a specific number here. There are other types, like HDL cholesterol. That one, yes. We do have a value for that, and ideally it should be higher than 40. Some sources say it should be higher than 50. But this one is the good cholesterol. The higher, the better. And another one that often gets overlooked, which is a type of fat, not actually cholesterol, but a fat in your blood, is triglycerides. For this one, ideally, it should be lower than 150. But taking care of your cholesterol is a major key to lowering your risk of stroke. And number 7, the last one, which can reduce your risk of having a stroke by up to 40%, is moderating your sodium and salt intake. Studies have shown that people who consumed the recommended amount, which is about 5 grams of salt or 2 grams of sodium per day, had up to a 40% lower chance of having a stroke, and that's scientifically proven. But studies also found that in many countries, like the United States, Germany, Spain, Portugal, and even in South America, the salt intake I mentioned, 5 grams, was actually more than double that, around 10, 11, or even 12 grams of salt. So it's really important to keep this under control. Here's how you can take care of it. Avoiding preserved foods like hearts of palm and brine, olives, pickles, and processed meats like salami, parma ham, coppa, and many salamis. Turkey breast, ready-to-eat foods like instant noodles. A single serving of instant noodles can have up to 70% of your daily sodium requirement. The chances of you having this excess salt, which increases your risk of stroke, are very high if you eat these foods. Ready-to-eat foods like boxed hamburgers, frozen pizza, lasagna, the kind you buy at the store in a box. So avoid boxed foods, avoid packaged foods, and avoid adding too much salt to your meals. And with these foods, if you also avoid processed meats, like I mentioned, you'll be doing something really great for your health. Not to mention all the other benefits, right? Here, I'm focusing only on reducing the risk of stroke, but it's really important to pay attention to this. If you check the label, you'll probably see that you're consuming more than 2 grams of sodium a day. Not to mention some drinks too that have sodium, a lot of sodium, but by avoiding those foods, you'll be making a smart choice. Did you notice I talked about cholesterol? There are foods that can help your cholesterol by raising your good cholesterol and lowering your bad cholesterol. There's even a food that can improve this ratio by 8%. It's really important for you to know what this food is to lower your risk of cardiovascular disease. I'm going to leave a more detailed video here for you. In it, I talk about these foods and cholesterol. I suggest you watch it. Take care. See you next time. Don't forget to leave your rating here, okay? I want to know.